Hello everyone. Today I'll be presenting about nasogastric tube, their uses, their indication, contraindication, and how to insert a nasogastric tube. Nasogastric tubes are used to gain access to the stomach. It may be used to drain gastric contents, decompress stomach, obtain specimen from gastric contents, or introduce a passage into the gastrointestinal tract. Their indications can be divided broadly into four categories. First one, feeding purposes. For example, for a patient who is suffering dysphagia after stroke, we may use a nasogastric tube to deliver food. Secondly, delivery of medication, which serves the same purpose as feeding. For diagnostic use, to aspirate volume of blood during gastrointestinal bleeding, or to deliver radio contrast solutions during X-ray examination. And finally, removal of gastric contents. It can be for diagnostic purposes, for gastric sampling, or we may even give gastric lavage in case of ingestion of toxins. Contraindications may be divided into two categories, absolute and relative. Absolute contraindications may be mid-facial trauma and recent nasal surgery. Relative contraindications may be coagulation abnormalities or recent alkaline ingestion, esophageal varices, and esophageal strictures. Let's look at the process of installing a nasogastric tube. Gather necessary equipments and wear non-sterile gloves. Explain procedure to the patient. If possible, ask the patient to sit upright. Examine nostrils for deformity and obstructions. Determine the length of the tube by placing it from the bridge of the nose around the earlobes till 5 centimeters below the xiphoid sternum. Note the length. Lubricate 2 to 4 inches of the tube. Pass tube via external nares, esophagus, and stomach. Whilst passing, ask the patient to sip water, which allows easy passage of the tube. Once the tube is installed, secure it with an adhesive tape. Aspirate for gastric content. This will show us successful placement of the tube. In the end, we may close the tube and dispose of the gloves and other materials. Thank you very much for your attention.